Hey guys, welcome back to my channel. So you are here today with me, Dr. Ashley. So today we are going to be talking about Tellogen Effluvium. Yes, this does kind of sound a little bit weird, a little bit Harry Potter-ish. Tellogen Effluvium. What is Tellogen Effluvium? So Tellogen Effluvium usually is going to be happening in younger women. However, this can happen in any age. And when this does happen is usually when you're going through a really stressful event or you're basically putting your body through something very stressful. So to first understand Tellogen Effluvium, we need to understand the process of hair growth. So I'm going to take you to my little board here and we are going to go over some definitions, and basically I'm going to draw out the best hair follicle that I can for you to show you how this is basically working. So let's go to it. The first thing that we are going to talk about here is the different phases of the hair growth cycle. So the three different phases that we have are going to be telogen, which is going to be the rest phase of the hair follicle. And then we're going to have the growth cycle, which we're going to put green here because green I just think of, nature and growth, which is going to be the anagen phase. So this is growth, okay? And then we also have a catagen phase, which is going to be an in-between phase. Catagen, okay? It's like the in-between. All right, and then just to tell you how the hair follicle is, so we can kind of understand this. So we do have a hair and we have another hair. So a hair follicle that is going to be in the anagen phase is going to be stimulated to grow. And that stimulation is going to come from down here in the hair follicle. A hair follicle that is not going to be growing isn't going to have this little hair bulb at the end of it. Is going to be very scant, okay? And this is the skin. So that's underneath the skin. So this hair follicle is stimulated to grow. This one is no growth, okay? So basically, if this one is growing, it is going to have a very good connection down here, because it is growing. Now the hair follicle is not growing in telogen. It is very easily going to fall out of the hair. It's just going to fall out, okay? It's going to go wherever it's going to go, into your shower, into your brush, into your hands, okay? But if it's growing, it has more of a stronger anchor here. Now, if the hair goes from the growth anagen phase to the no growth telogen phase, again, that is going to be the catagen phase when it goes over here. That means, again, it is going to lose this, and all these hairs that are in the anagen phase are going to start falling out. So what proportion of our hair is actually in the anagen phase compared to the telogen phase? Well, let's make sense of this. Your hair is usually growing, and it is usually not stuck and stopped. Most of your hair is in this anagen phase. It can be up to around, let's just say most of it. So just throwing out a number there, it can be like 90%, and this can be 10%, all right? So usually you might have 10% of your hair shredding. Okay, so let's say your anagen phase goes to telogen phase faster than usual. So now your anagen growing hairs that are stuck into your head are going to be, let's say, only like 50% of your hair, and then your no growth telogen phase is going to be 50%. So guess what? Now you're going to start shedding 50% of your hair. Now these are not exact numbers, but this is an easier way that I can explain it to you. So instead of you having this one hair shred, now you're going to have a ton of them, okay? Shred. And then that is why you might be coming here to watch this video now is because you've noticed that you have a whole lot more hair shredding and you don't exactly know why. Well, I am here to help you and tell you why this might be happening. Okay, so let's talk about why your hair might be going from that anagen growth phase to that telogen rest, stop, no growth phase. Tell me this, have you had a huge stressor in your life? Have you recently given birth? Have you been in some kind of surgery? Have you been sick? Have you been having fevers? Did you start some kind of new medication? Even if that medication is birth control. Have you been really emotional right now? You know, are you going through something like a breakup, a divorce? You know, did you just get kicked out of your living situation? Are you basically just putting more stress on your body in some sort, form, or way? This can all lead to your body basically saying, no, we need to preserve our body, stop growing, stop using your energy to grow. So in this same way, how do we get energy? We get energy from the foods that we eat. So if you're not eating right, you're not eating enough protein, then your body might also go into this stop, halt, save our energy, and stop growing the hair, which leads from the anagen phase to the telogen phase, and you start shredding more hair. Now, if you're saying, well, yeah, you know, I did go through a really stressful event, but that happened to me like 2 months ago, and now I'm randomly getting this hair loss. Well, you're exactly right, because your hair is going to take about 3 to 6 months to actually show the changes of that stress that you put your body through months ago. And to remember, your hair, after you go through this stressor, is not going to start growing back until about 6 to 12 months at least. All right, and the reason why it can be up to 12 months because the way that we see our hair is all very objective. And to see our hair actually growing, we need to see length on our hair. And we all know to see length on our hair takes a while for our hair to actually grow. Some other things that I want to mention as well, if you think about it, if you have a poor diet or you also just have, you know, family history and your genetics of anemia and you're anemic, this can also be a reason for your body to have some extra shredding in the hair, as you do have more hair in the telogen phase. All right, so how do we usually diagnose this? Well, the diagnosis of this is basically on your story. So if your story aligns with the things that I'm telling you today, and you've been having your hair fall out after that, then it is most likely that you were probably having Tellogen Effluvium. And please just remember that even though I am a medical doctor, I'm not here to tell you any diagnoses. I'm just here to diagnose you. I'm just here basically to give you more information and education on this subject because, you know, I know this is really hard and this can be very embarrassing for any woman to go through, and it can be very emotionally stressful just to see that, especially if you know that your hair is falling out, and so people might not really actually believe you that it is happening. Anyhow, if you do go to the doctor and you do present with this story that basically I have told you, then it is very likely that you are suffering from Tellogen Effluvium. And one way to diagnose it is kind of this test that a doctor might do that kind of seems a little bit weird, but basically a doctor can do a hair pull test, right? Yeah, so the doctor would sit there and take like 60 strands of hair or so and then pull on that area of hair and then count how many hairs come out, and they would do it in different sections. So I have actually had doctors you know, say these things, oh, do the hair pull test, especially when I was in medical school, but it's usually more of it's very subjective, meaning that depending on the day, maybe you just brush your hair or whatnot, maybe a lot of those hairs have already come out. I think it is enough to just diagnose this based on what you tell your doctor. There is some things that I want you to remember, that there is another type of hair loss, and this hair loss is androgenic alopecia. So you can get this if you have problems with your hormone regulation. A lot of women with PCOS have this. So if you do have problems with, you know, really severe acne, or you do have problems with infertility, you know, or getting pregnant, then there might be another reason, which would be anagen alopecia. is why you might actually be having your hair fall out. Back to ways to actually see if you have Tellogen Effluvium is the type of hair loss you are actually getting. So the type of hair loss that you're going to get in Tellogen Effluvium is the type of hair loss that is more diffuse all over the head, but it can be more pronounced in the temporal areas. So the temporal areas is this area over here, or it can be more in the frontal area. Now, if you do have the androgen alopecia, which is more to do with maybe having more testosterone in your body, you might notice that you have a fine line of hair. It actually spares the front of your hairline right here. But in Tellogen Effluvium, you're going to notice that you're going to have hair loss in the temporal area, hair loss in the frontal, maybe hair loss more in this vertex area or crown area. So if you can think of wearing a crown in that area right there of your head. If you do decide to go to the doctor, then they might be able to work you up for things like anemia, so which would be having low blood count, or they can also check some of your vitamin levels as well as looking to make sure that your thyroid is okay. And then if you're having a hard time thinking about, oh, is this Tellogen Effluvium or is this androgen alopecia, then we can also test to see your hormone levels, like your testosterone. Okay, so some of you might be thinking like, oh my God, get to the point. What is the treatment of this, right? Well, anyhow, the treatment is exactly what you were telling me. So if you're telling me that you've been through a really stressful time, or you're telling me that you are not eating well, you know, maybe you have protein deficiency, maybe you have anemia, or you've went through that breakup or that divorce, or, you know, now you have to move, or you're going through a really hard time with money and you've just like stressed yourself out, or you've gone through, you know, a recent surgery, you have to think about how you can actually try to get rid of those stressors in your life, or how you can at least decrease those stressors in your life, like doing things like meditation, you know, taking runs or working out, or just eating healthier if that's like the main reason why you might be having your hair fall out. And also you can just get an over-the-counter supplement of vitamins as well, or taking that iron supplement if you need to. And if you did just start birth control and you notice that your hair is falling out like 3 to 6 months later after you did, I would encourage you to continue to take the birth control, because your body should get used to the hormone differences, and it should get better over time. So remember, though, even though you did have this inciting event, it is going to take a long time for your hair to come back, even up to a year. But I do also want to tell you that you can have this chronic Tellogen Effluvium. So chronic no growth hair, which leads to hair loss. And this would be for someone who, you know, let's say they go through a breakup and then they have to move out somewhere, and then they're starting college, and then they're in college and they fail a class. So you're having all these kind of events that after each one, your body might not be responding to it until 3 months later, or you might not see the body's response until after 3 months. So that means you have chronically put your hair back into the more Tellogen side, and you have less hair growth from the androgen side, which will lead to you chronically having hair loss. I think in these cases, you have to really be listening to your body and really thinking about how your body feels, and, you know, trying to do things that you can do for stress relief. Now, if you do or are suffering from this chronic Tellogen Effluvium, there is actually products that you can get over the counter, which over the counter means that you don't need a prescription for these. And these products are actually some products that I do have experience in using, because, you know, I went through medical school and residency, and I go through times where it is very tough, it is very long hours. And, you know, there's times where I'm not sleeping well, and there's times where literally, I promise you not, I've gone 12 hours or longer without eating. And, you know, that led to having like poor nutrition, you know, anemia, iron deficiency anemia, and all these things. And I kind of have had more of a chronic Tellogen Effluvium. So I've been using these products that I'm going to show you, because with these products, which are called Minoxidil, That's the active medication in these products. The minoxidil can help bring your hair follicle back from the telogen phase to the anagen phase. But I'm telling you that this is not going to be a miracle. This is just something that can help, and it might not always work. So I have two products here that I've actually used both of them. So the first one is like, looks like kind of old and stuff because it's gotten wet and just like the label's kind of messed up. I buy the generic brand of a lot of brands. It's just cheaper to me. And if I know that it has the right active ingredient, then I'll just use it. But this one is super easy to use. It's just a dropper, you see. It's just a dropper, and it has a medication. The medication in it is almost like water. If you can see it go there, it's like water, and I really like it. Basically, I just put it in my head, and I put it here so it gets right on the scalp, and I put it out, and I put it out. A little bit's coming out now, and then you have to rub it in. But when you're using these products, you want to make sure that it's dried before you go to bed. This one is a 2% minoxidil. You're going to use that twice a day, once in the morning and once before bed. But put it in at least 2 hours before bed so it dries and it doesn't get all over your pillowcase. And next thing you know, the minoxidil is getting all over your face and causing you to have facial hair growth. The other one that I have here is the foam minoxidil. And this is actually the Rogaine product. So I don't know about you guys, but buying the Rogaine for a woman is, I don't know, I felt like it was kind of embarrassing because it's Rogaine and you know, you're always like, oh yeah, he has to wear Rogaine and stuff. But if you think about it, like, you're just trying to help yourself. So you go and get these products if you need them. Of course, you can always get them online. I will actually put some links down below so you can buy them online and get them at home. And guys, it is very normal to be, you know, upset or even more stressed out about your hair falling out. And if you do, you should take that stress very seriously. And if you need to, you should actually get help to help counsel yourself and, you know, deal with the emotions, which can also help you deal with other emotions and stress that you might have been going through. This is the Rogaine, and this is just a foam, and this is 5%. So you only use it once a day. My issue is when I'm using the little dropper minoxidil, but that's 2%, sometimes I don't use it morning and night. And this one is a little bit easier to use once a day, but I found that it does make my hair or my scalp really dry. So I actually like the little dropper, and I feel like the dropper is just really nice. It feels a little bit more lightweight than the foam, but it's the same concept. So I just put it again like in my scalp, and I press a button to put it in there, and that works pretty well. But like I said before, I noticed that this one does, the Rogaine does actually dry my head out, and then I have dandruff, which can also be embarrassing. But if you gotta do what you gotta do, I'd rather have my hair there than dandruff. All right, I do want to make sure that you do know that if you are going through Tellogen Effluvium, that you are not going to lose all your hair. All right, you are not going to go bald. Your hair is still going to be there. You just have to realize what you are going through, set this off, and your hair will start growing again, but it's going to take time. Although, like I said, if you do go through that chronic Tellogen Effluvium, then you have to try to figure out a way to reduce those stressors and try to get healthy. Even if it's within your food and you need to eat more, or you need to take a dietary supplement, then you gotta do what you gotta do. Or if it means that you need to use minoxidil, then that is okay too. All right guys, well, I'll see you next time. Bye bye.